Thank you to the Wolfeboro Lions Club for underwriting nutritional wisdom. The Wolfeboro Lions Club is committed to helping the community with health concerns such as diabetes prevention and preservation of sight and hearing. The Wolfeboro Lions Club meets on the second and fourth Tuesday of the month in the 1812 room at the Wolfeboro Inn. Members of the community are encouraged to attend meetings or visit the website e-clubhouse.org/sites/Wolfeboro for more information.
Hi, this is Patty Walker, registered dietitian, certified diabetes educator, and your host of Nutrition Wisdom. Today will be the 9th in a series of diabetes classes. I again will be using the materials from the diabetes conversation maps, which are the same materials used in many certified diabetes programs. As always, my goal for you is to give you the necessary information to allow you to manage your diabetes from the comfort of your home. And speaking of home comforts, you will be noticing that my guests and I will be taping a segment from our homes as we socially distance during the COVID-19 pandemic. Since the classes work best with interaction, I am thrilled to be joined with community members who have participated in previous episodes. So again, I'd like to introduce or reintroduce Michelle and Dawn, and once again, thank them for helping out.
Happy to do that.
Glad to be here.
Oh, so appreciate you. You guys are vital to the success of these, so really appreciate your time.
Sure.
All right. In my previous episode, I reviewed all the types of diabetes medications, their uses, and also their potential side effects. If you haven't seen that episode, I encourage you to watch as if you haven't already had the chance. Today, we will be having a conversation about the natural course of diabetes and delve into some of the possible complications associated with diabetes and what you can do to reduce the risk of getting them. Michelle and Dawn, we're going to put up a picture of the map on the screen that we'll be using today, and just kind of would like you to look at it and give me some feedback as to what is some of the things that you notice. What do you see about this map?
Well, there's a lot of options. There's the oral, there's the other, that's other,
Yeah.
and there's the insulin. So what is right?
Well, that's a very individual answer depending on the person's course of diabetes, in addition to what they're looking for. So in the other diabetes medication categories, I personally think of the inhaled insulin and some injectable medicines that aren't insulin, but you could also put hypertensive agents or high blood pressure medicine and cholesterol medicine in the other diabetes medication categories, because it's very common for a doctor to prescribe medications that cover all three to reduce your risk of long-term complications. It's a very individual map, because every person is different. Some are only treated with diet alone. Some are treated with 2 or 3 oral medications. Some are treated with oral medications and insulin.
Yep.
So it's very personalized, which is good. It should be personalized.
So in my case, I was already taking blood pressure medication and cholesterol medications prior to me knowing that I was a diabetic.
Yeah.
So I never ever considered those to be part of the insulin or
Well,
part
they're
of
not
the
part
diabetes.
of insulin, but they're part of diabetes management.
Mm-hmm.
Yeah, it's really not uncommon, especially high blood pressure medicine, because it protects your kidneys. So I do know of physicians that will immediately put someone on like lisinopril, a small baby dose, just to protect their kidneys, for the hopes of preventing any long-term complications. But my goal is always to try to do it with lifestyle, and then add the medications as things go on. So yes, the medication journey is certainly a very individualized one. Anything else on the map that you notice?
Well, it ends with insulin. So maybe when we're talking today, the only time I ever had insulin was pre-surgery,
Yes,
which we talked about in the last session, I think.
sure.
And but should everyone who has diabetes expect eventually to be on insulin?
No, but that is what one of the things that we're going to be talking about today is the natural course of diabetes and why people may be on insulin if they do have type 2 diabetes. So this is one of my favorite series, this particular map, because there's so much to cover. All right, let's begin our discussion with a general question. How long have you or your loved ones been diagnosed with diabetes? Do you remember?
I remember the day I was diagnosed, but I don't know what year it was in. So
Oh, you remember the day, but not the year. How come you remember the day?
yeah, Friday afternoon at 2:00.
Oh my gosh.
Which was very unsettling because I wasn't able to talk to a doctor until the next week.
Sure. Yeah.
So it's been about 10 years.
Okay. And you have a family member with diabetes. Is that correct, Michelle?
Yeah, I've actually got two.
Okay.
And my mother has been diagnosed for years.
Yep.
Years and years. And I've seen a great change, both positive and negative with her.
In what way?
She denial originally. Said, no, it doesn't affect me. It's not going to affect anything. I'm just going to keep doing what I'm doing. And she went from diet to oral medications, which didn't work, to now she's on insulin. And now it's gotten more serious, of course, with all the side effects as well. So,
Okay. Hopefully she'll be able to watch this show.
don't
Send
you
her
worry.
a copy of it. At least have it in her hands, because
Right.
we're gonna be talking about all of that. All right. So my next question was actually how have things changed since diagnosis? So you've mentioned how the medications have progressed with your mother, and perhaps she's developing some long-term complications that are associated with diabetes.
She did. She had some challenges prior to, which it's only making it worse. The
Okay.
COPD and things like that. It's only making it worse. But
Right.
the issues with the feet and the heart are now beginning to rise. And she's a little bit older.
Yep.
So yeah, we're watching that.
How about you, Don?
Well, I have never experienced any of the typical
That's right.
situations, possibly because it was caught early, and your class that I went to helped me from the very beginning to start dealing with changing habits and working on that, and that was extremely successful.
Yeah.
However, I'm going to be 80 in 3 days.
Oh my goodness! Happy pre-birthday.
So I'm wondering when I'm going to get old.
Well, I don't think you're there yet. So I think you're okay. Yeah. Well, I will say my dad was my inspiration for me to become a diabetes educator, and he did not understand diabetes. He thought he was cured when he was on insulin. He thought that medication basically cured the condition, and he had poor circulation. He had heart disease, high blood pressure, obesity. Those are very common complications if you don't take care of yourself, and he was in that category. But the one that really affected his quality of life the most was peripheral neuropathy, which was such pain in his feet that he couldn't walk. I mean, he walked, but it hurt when he walked, so it prevented him from doing activity. And I've seen other clients where they lose their eyesight, and talk about a game changer as far as quality of life and what you're able to do when these things happen. So, hopefully today's show is going to help the audience understand what these complications can be and how to prevent them.
Absolutely.
All right.
Since the pandemic started, I have not been able to work out at the Back Bay Rehab, which I had been doing
Yes,
for
the
a
gyms are
long time.
closed.
And so I'm wondering when I take my next A1C, whether that's going to show at all.
It probably will. And, you know, because activity is a major, well, it's not a major, it is a part of it. Same with all of a sudden you have increased stress, or you had the COVID-19 virus or pneumonia or something. Those things will all be reflected in your A1C. And realize it may take 3 to 6 months for it to go back to normal once your lifestyle goes back to normal.
Mm-hmm.
So as long as you have a reason why it bumped up or down, I mean, ideally down, but why it bumped up, I'm not going to be too concerned about it unless you're having overt symptoms of high blood sugars, and we're going to be going over those soon.
Mm-hmm. Right.
Okay. Anything else you want to add, Michelle?
Just that, you know, it's with my mom being a diabetic, you know, I've obviously come to you for some guidance on how I can change the course of the family. And it's eye-opening what you can do if you have the information in front of you, the changes that you can make. So
Yeah.
I am a testament to it.
Well, good. That's
Yep.
excellent.
Yep.
All right. We're going to continue on because as you both know, diabetes is a lifelong disease. And while it's possible to get your diabetes in remission, most people's journey will follow the natural course of diabetes. And the viewers are going to see a slide on the screen. But Dawn, could you read what that sign says?
Sure. In type 2 diabetes, there is a gradual loss of beta cells that make insulin. Over time, there are not enough of these cells to meet the insulin needs of the body and to keep blood glucose in target range.
Excellent. Does that make sense?
Yes.
Okay, so we have cells in our pancreas that produce insulin, and over time, they do produce less insulin. And as we age, we naturally produce less insulin. Our body just is getting ready to shut down. So we produce less stomach acid, we produce less saliva, we produce a lot of less. So insulin is one of those things that we just produce less of, less testosterone, less estrogen. I mean, these are the natural functions of aging. But in addition, lifestyle choices such as eating a diet high in processed carbohydrates, being inactive, being really stressed, or not taking your diabetes medications as prescribed can also reduce your body's ability to produce insulin. So this is why some people with type 2 diabetes may actually need insulin. It's not a failure, it is a treatment option. And but with that said, we know that lifestyle choices can reduce the progression of type 2 diabetes too. So we're going to certainly review those again in our next episode. Okay. So for now, let's take a quick look at the recommended blood sugar goals for persons with diabetes. There's going to be another, that's going to be on the screen. So Michelle, can you read what these ranges are?
Absolutely. So to keep your blood glucose on target, your fasting blood glucose and your blood glucose before meals should be 90 to 130. 2 hours after the start of your meal should be less than 180.
And hopefully the A1C below 7. The reason I mention that is because the A1C is a 3-month look back as far as what your blood sugar percentage was in the previous 3 months before you go to the doctor's office. So you don't have to fast for that. So that's convenient. But what it does, what that particular lab does, it's our best predictor for your risk for long-term complications. So keeping that A1C under 7% reduces your risk of long-term complications. So that's an important one. Okay, the blood sugar testing before and after meals is kind of the here and now. It gives you a snapshot of how you're doing. And if it's in those ranges, then your A1C should be around 7% or less. But the A1C, if it's consistently above 7%, then you are at risk for some long-term complications, and some of them are silent and they're not reversible. So we're going to be talking about that. And the other thing I just want to reiterate is that the blood glucose goals can be different for different people. The ones you read are by the American Diabetic Association or Diabetes Association, but it's important to have your goals individualized based on your health, your circumstances, your age, and your health team can help you with that. But why is maintaining blood glucose in a target range so important? I think we've already said it, but.
Well, to reinforce exactly. And if you see that it's going higher, you should pay attention to some of the things that you know are going to help reduce it.
It's a good way to test. It's a good way to, it's almost like jumping on the scale every day to see what your weight is. It's a good way to keep you in check.
And I like that reference because a lot of clients are afraid to get on the scale because they think that number is a judgment of them, and it's not. And a lot of my clients think that blood sugar numbers are a judgment of them. Oh, I failed again. Oh, I did really good this time. I don't know why, but I did really good. So it's just a number. Just remember, it's just a number, and watch the long-term trends is what we're looking for, not the short-term staticky ups and downs. Like as Don said, if his A1C goes up the next time he has it because he hasn't exercises, he knows why that happened, and get back to activity, and you'll be back to normal as far as your regular A1C.
A couple of weeks ago, I had Chinese food, and then I tested it after 2 hours after eating, and it was way off the charts.
It was a little high.
Yeah, maybe that's not one of the best foods for.
Yeah.
Well, but it shows that it still can be fit into a diet. But Chinese food, anything that's deep fried or high in sugar and processed, it's just going to raise your blood sugar a little bit longer than the others, especially if it's a high fatty meal. Like Chinese tends to be pizza, lasagna. They're just higher longer after the meal. Fast food of any kind, a hamburger with fries, those types of things. Yeah. All right. So reducing your risk of complications is a very, very important part of diabetes management. And there are two categories of complications: short-term complications and long-term complications. So the short-term complications can happen when your blood sugars are too low or too high. These are often called signs and symptoms. And we actually have a list of them on the map. So that's going to be on the screen. And it's surrounded by storm clouds. So Dawn, can you read what these short-term, the signs and symptoms of both high and low blood sugars are?
Yes. For high blood glucose, fatigue, blurred vision, thirst, headaches, frequent urination, and mood swings. And for the low blood glucose, shakiness, sweats, headaches, moderate swings, irritability.
Mood swings, actually.
Mood swings.
Yeah.
Irritability, confusion, hunger, and fast heartbeat.
So we've reviewed these in previous shows, but it's always good to refresh and hear them. And as you see, most of these symptoms, you can guess if your blood sugar is high or low, but some of them, such as headaches, it could be a symptom of a high or a low. Right. So how would you know if it's high or low if you have a headache?
You got to test.
Yeah, test.
Yeah. But in my case, since I've never experienced low blood sugar examples, it's probably high blood pressure. Yeah.
And the other way is, the way I remind my clients is the low blood sugars come on very quickly. Those symptoms just happen. You're feeling fine. And all of a sudden you break out in a sweat, or you get a headache, or you're extremely hungry. You're irritable, and everyone else like, what's up with you? So if you recognize those as lows, it's optimal to test, as Michelle said, to get out your glucometer and test to see where you're at. And again, some people, can have low blood sugars when their numbers are 130 or 120. By definition, a low blood sugar is under 70. But if you're a person whose blood sugars have been really high, like in the 300, 400, 500 range, and your blood sugar gets to 130, you could experience some of these symptoms. So you would need to treat your low blood sugar. And I would encourage you to go back to the previous episodes that talked all about these symptoms and how to treat it, because it's important that you treat it. But yes, and the other way is, if you don't have your glucometer, kind of think back as to what happened. Did you take your medication and then get a phone call and your meal is now delayed? Or did you not eat any carbohydrate at lunch? You decided to have a salad and chicken, and you're on medication that kind of requires you to have some carbohydrates throughout the day. Then, and you get those symptoms, probably a low blood sugar. Yeah. But if you just had Chinese food and it's 20 minutes later, probably a high blood sugar. So you can be your own detective, but understanding those to know what those signs and symptoms are and relating to whether it's high or low is important.
And I can usually tell with friends and family who have diabetes type 2, I can usually tell. I'll always say, a little irritable. Do you mind? Maybe we should take a look at your blood. Mm-hmm. So it is, having someone there to support you is good too.
That is very true, because as you say, and Don has said, he's never experienced low blood sugars. You may have. I'm doubtful that you have, but oftentimes people with diabetes don't recognize their own symptoms and don't feel the symptoms coming on. They might see why am I sweating, but they don't feel hot, or they don't recognize that they're irritable. Then that's why it's so helpful to have loved ones be part of your support team so that they can help you out at home too. So yeah, that's so important. Okay, so the short-term complications have to do with the here and now. Long-term complications are different. And those are the ones that can have a major impact on your overall health. So many people don't like talking about long-term complications because they seem scary, and they are. If you know people with diabetes, I've had people say, oh, I can't start insulin, it's going to kill me, because when their uncle started on insulin, he ended up having a leg amputated, or he died 6 months later or something. So they've always associated starting insulin as leg amputations and death. Mm-hmm. And so there's a lot of misnomers and confusion about that, but that's their personal experience, and you have to recognize that. So, I think I'd mentioned in a previous episode, I had a client come in, her entire family, she was one of 12, comes in with diabetes, and she says, all I really want to know is which long-term complication I'm going to get first. As we test her blood sugar in the office, and it says high, HI. And I said, you have a very friendly meter there. Let's get you a new one. And the new one was also HIGH. It was, her blood sugars were over 550 when she was sitting in my office. But her own experience was, diabetes, you get long-term complications and you die. So we're all going to get it because my entire family has it. So which complication am I going to get first? So that's hard, but they're not inevitable. And the good news is we know more about preventing and treating them. So I believe power is knowledge, or knowledge is power. And, the more we have and the more we are able to give you information, the better off you're going to be able to manage your diabetes. So getting to long-term complications of diabetes, they affect every system in your body. Blood gets to every system can be affected. Not will be, but can be. And oftentimes multiple systems are affected. It can damage your blood vessels and your nerves. They can damage your heart, your legs, your feet, your toes. They can affect your kidneys, your eyes, but they can also be prevented. So that's the message I really, really want to reiterate. So with that thought, let's take a look at some of the specific long-term complications that can result from having diabetes. And ahead of time, I've given you both some cards. You each have 3 cards, and I'm going to ask Michelle to start. And there should be a graphic on the screen also, so the audience at home can follow along. So Michelle, what's the first card you have?
Heart disease and stroke. So people with diabetes have an increased risk for heart attack, stroke, and complications related to poor circulation.
Number 1 killer of persons with diabetes is heart disease or stroke. 50% of people that have a heart attack and didn't know they had diabetes find out at the diagnosis of the heart attack.
Yep.
My dad died of a heart attack. I mean, it is the number 1 killer. So it's very, very important to manage your risk of not only high blood sugars, but also cholesterol and blood pressure. Yeah. So Don, what's your first card?
Kidney disease. Diabetes can damage the kidneys, which not only can cause them to fail, but can also make them lose their ability to filter waste from the blood.
It's true. So uncontrolled diabetes is the number 1 reason for people being on dialysis. And dialysis, it keeps you alive, but it also really affects the quality of your life. You're limited with your fluid amounts that you can drink, and you're going to a dialysis center 2 to 3 days a week for the rest of your life if kidney disease happens. And kidney disease has no symptoms. So that one's super important, and we will talk about what tests are important to check the quality of your kidney functions, because you need to stay on top of that one, because that is not a reversible condition. Yeah. All right, Michelle, you're up.
All right, eye complications. Diabetes can cause eye problems and may lead to blindness. People with diabetes have a higher risk of blindness than people without diabetes.
That is also true. And a symptom that you might have is so I had a client who had a very stressful job, and he'd come home from his job and he'd want to relax and read the newspaper. And reading the newspaper, he'd noticed that he just couldn't read the newspaper at the end of the day, and he always thought it was his reading glasses. But it was the stress of his workday elevated his blood sugars, and the blood sugars absorb fluid and water and cause swelling behind the retina, and it causes blurred vision. So if you notice occasional blurred vision, that is an important reason to talk to your doctor, and also to see an ophthalmologist, and get your blood sugars in control, because those are early warning signs that feel fortunate that you can have. Yeah. Don, what's your next card?
Nerve damage. Diabetes can cause damage to nerves that run throughout the body, including nerves to the spinal cord, to muscles, the skin, blood vessels, and other organs.
Yeah. Numbing and tingling of your hands and feet can actually be a sign of undiagnosed diabetes. But if it's constant with diabetes, really get the blood sugars in control. You need to make a little bit more effort, because those are not reversible either. So that numbing and tingling is neuropathy. And as I had mentioned earlier, that was my dad's biggest frustration, is how much it hurt to walk. It's like walking on crushed glass.
Yep, my mother has that as well. It's horrific just to see the pain on her face.
Yep. And the swelling in my dad's lower legs, his calves were purple. He had compression stockings on all the time. So he had blood vessel. And when they did a catheterization of his heart, all but one of the vessels were clogged. And so it damages. Think of high blood sugar as making the blood sugar stickier, so that plaque is more apt to form. So some of these can be prevented. Some of them can't. And the nerve damage, the eyes, the nerves, and the kidney, those ones are silent and permanent. So just be aware of that.
Yep.
All right, Michelle, I think you have one more card.
I do. I've got foot complications. People with diabetes can develop many different foot problems. Foot problems most often happen when there is nerve damage in the feet or when blood flow is poor.
That is true. So, so that is why we ask people with diabetes to do daily foot checks, to make sure that there's no blisters, no warts, no corns, no cuts, nothing unusual, because they're slower to heal. So the sooner, so that's a preventative thing that people can do, is daily foot checks, and then once a year see a podiatrist, or have your PCP do a comprehensive foot exam. We're going to be talking about these tests in our next episode, but it also, a comprehensive foot exam means your shoe is off, your sock is off, and they look at the bottom of your foot and they do something called a filament test, which measures your sensitivity on your toes, along the sides of your feet, and on the ball of your feet, so that you will know if you have any areas that are numb, so that you can pay better attention to those when you're doing your daily foot check. And if you can't see the bottom of your feet, use a mirror or ask your loved one to help. And take a bath before you do it. No one wants to look at smelly feet. All right, Don, you got one more card for us.
Okay, skin complications. As many as 1/3 of people with diabetes will have a skin disorder caused or affected by diabetes at some time in their lives. In fact, such problems are sometimes the first sign that a person has diabetes.
Yeah. Dry, itchy skin. Very, very common in diabetes. So again, that's why if persons have it, we ask that they use lotion, but don't lotion in between the toes, because that can cause too much moisture to stay between the toes. And cuts and wounds that don't heal. These are symptoms of diabetes if people aren't already diagnosed. Yeah. Fun stuff, huh? All right, well, I got one more, and this is actually a common one. I would say, I think I had read a statistic years ago that 50% of persons with diabetes actually have this comorbidity or diagnosis, and it's depression. And feeling down once in a while is normal, but for some people, the sadness just doesn't go away. Life for them seems hopeless. Feeling this way most of the day for 2 weeks or longer is a sign of serious depression. And it's the chicken and the egg. Does depression, is it the precursor to diabetes? Because you're depressed, you're not taking care of yourself, and you're not exercising as well, you're not eating as healthy, so you're increasing your risk for developing diabetes? Or is it, now that you have diabetes, it's just one more thing you have to worry about, and it's overwhelming? So there's lots of help for this one, and I encourage you, any person that does feel this sense of helplessness and hopelessness, and actually in the current times of COVID-19, I think it's pretty rampant. Anxiety, things like that. So do discuss the symptoms with your PCP, and get a referral to a counselor, because there are options on this one, which is nice. So now I have another question. Any other conditions for persons with diabetes that you think that you think that persons with diabetes are at increased risk for? Have you noticed any other, like I said, 50% of the people with diabetes have depression. Have you noticed that people with diabetes also have other common or other medical conditions?
I would say that anybody that we see that's obese probably has diabetes, whether they know it or not.
Well, it's certainly an increased risk factor.
Mhm.
Yeah. It always befuddles me that we have, what is it, 2/3 of our population is overweight or obese, but only about 12% actually know they have diabetes. So I think that's the key. A lot don't know it. And 50% of the people over age 60 have prediabetes or diabetes. So yes, so obesity is a big risk factor, and especially in the pre-diabetic population, the number one thing is lose 5 to 7% weight loss and get out and be active 30 to 60 minutes a day, and your risk of developing diabetes plummets. So
I think that is so important because, I was a pre-diabetic for many years.
mhm.
The doctor would say you're pre-diabetics, just wanted to let you know, like, okay.
Great.
But then when I took your class and we talked about losing weight as one of the major things that can help you prevent going into full diabetes.
Yep.
And that's something that is probably difficult for a lot of people.
Yeah.
But the rewards are enormous, not only in diabetes, but everything else in your life.
Yes, that is true. And I'm going to say, people often think of weight loss as just this overwhelming task because, oh, they've tried and I failed so many times on different things. But breaking it down into small, simple steps, but also realize 100 less calories a day. 100 less calories a day. That is a tablespoon of oil, salad dressing, a tablespoon of butter, a tablespoon of peanut butter, a half a handful of nuts. I mean, it's not a lot. It's, a half a bag of potato chips. You cut out 100 less calories a day, you'll lose about 10 pounds of weight loss in a year if everything else is the same. So, there are simple things that you can do. And, if you're looking for nutritional advice where you can get balance and other information, then I'm your gal. Yeah.
But of course, the keto diet is the way to do it, right?
No, the keto diet is not the way to do it. And but the funny thing is you will get short-term results on the keto. So people on the keto diet see their blood sugars lower and they're like, yes, this is working. And it's like, so they get weight loss and they get instant feedback that their blood sugars are lower. However, the root cause of type 2 diabetes is insulin resistance. And insulin resistance is, imagine insulin is the key that goes around to unlock the cell doors to allow the sugar into the cell. Insulin is the escort for sugar into the cell. Well, insulin resistance is like someone put fat in all those keyholes. And you need to get rid of the insulin resistance if you want to get rid of the type 2 diabetes. So a keto diet will manage the blood sugars a little better, but it's not helping your immune system. It's not helping your risk for heart disease. And, so it's kind of smoke and mirrors. Yeah.
Yeah.
Thanks for that one. Any other conditions that you can think of that people with diabetes might be at increased risk for?
You mentioned depression, and I didn't realize depression was part of that, but the increase, being in the healthcare industry, the increase of Alzheimer's, I see that. And we've also got the increase of diabetes. So I'm just looking to see if there's a correlation.
If you do a Google search on Alzheimer's, or no, better yet, do a Google search on type 3 diabetes. It's also known as Alzheimer's.
Mm-hmm.
Yep.
Wow.
So people with uncontrolled diabetes are at increased risk for Alzheimer's. And Alzheimer's is a disease that happens over decades. Yeah. So again, it's one of these silent ones that once the symptoms are there, we can't reverse the symptoms. So good management of blood sugars, yeah. So those two are great. And I always see, and there's two others that I'm going to mention. One is high blood pressure. I just happen to see it correlated. But one that people don't think much of that I have realized is low vitamin D levels. There's not a lot of good published evidence-based literature out there. So for me, it's more anecdotal. But I do see when clients come into my office with newly diagnosed diabetes, I'm going to say 75% of the time they also have low vitamin D. So there's no harm in making sure your vitamin D levels are optimal. And I don't even say at normal range. Normal range is 30. To me, that's too low. Optimal is like 50 to 80. That's in the optimal range. And we get vitamin D from the sun. So right now, we're at summertime in Wolfeboro, New Hampshire. Please consider going outside, enjoying the sunshine. What you want to look for is up to 15 minutes of exposure without your arms and legs, without sunscreen on, or until your skin turns pink. So you press it and it turns pink, and you can say, oh, I'm getting a little pink. You've gotten about 10,000 international units of vitamin D on that one 15-minute outside excursion, and our body will store it. So we don't live in an area that gets a lot of vitamin D from the sun because we're only at prime range from May through the end of September on average. So the majority of us are at a vitamin D deficiency risk. So take advantage of the sun when the sun shines.
Absolutely.
Yeah, those are the other things I think associated with. And so why would diabetes lead to any long-term complications? We really want to get this point down. So one of you can reiterate why diabetes leads to long-term complications?
Poorly controlled blood sugar.
You got it. So it does nobody any good to stick your head in the sand and not test your blood sugars because you think it's a judgment on you. Those numbers help us, help you.
Yep.
It may, we may be able to tweak the diet, we may be able to tweak the activity, we may be able to help you with the sleep, the stress. So it's not always medications that have to be adjusted. It is an entire package that we look at so that we can help you live your best optimal life. Any other questions about these lovely, the lovely topic of complications?
Well, the only question that I would ask is, what are doctors doing about this other than prescribing a medication?
You have to ask doctors that. Different doctors approach diabetes in a different manner. So I am not at all here to do anything but praise medical professionals that are in it to sincerely help you, you know, live your best quality life. I mean, you do have options of integrative doctors will approach diabetes differently than conventional doctors because of their training. Conventional doctors are trained to treat symptoms. And many people with diabetes want their symptoms treated. That's their choice. I don't want to change my diet. I don't want to change how I eat. I don't want to exercise. Is there another pill? And so, and as much as the conventional doctors try to suggest lifestyle changes or refer to people that can offer lifestyle changes and support, sometimes people don't want to change, and you got to meet them where they're at. Integrative doctors will look towards the root cause and say, do you realize that if we can eliminate that insulin resistance, and these are ways we can do it, and diet is primary, then we can back you off these medicines, and we can you know, get you down so that your numbers are not in a diabetic range. And this happens too. So it really depends. You have to match the goals of the individual with the goals of the practitioner. And if you're not having your goals met, I would encourage anyone to look further for support. So I do think that conventional medicine, there is a strong role for it. But the individual's needs to be met as best possible. I hope that makes sense.
It does. And especially being in the healthcare industry, the majority of the people that we see that are, geriatric, unfortunately have a comorbidity of diabetes, type 2.
Yeah.
And these are great trainings because people can see what could possibly happen.
Right.
You know,
And what's interesting is normal isn't healthy always. So if you look at our society, I'd suggested 2/3 of the population is overweight or obese.
Mhm.
That's normal. Normal is something that's over 50%. So in our society, being overweight or obese is normal. So people look around and they see other people that look like themselves and they think they're healthy because that's the norm. And same with type 2 diabetes. 50% of people over the age of 60 either have pre-diabetes or diabetes. It's like, yeah, everyone has it. I expected this. I mean, isn't that normal? And it's like, it doesn't have to be. So, but we need to respect the individual where they're at and what their personal goals are. And, sometimes it's going to happen despite your best efforts. I've had clients who did everything right. And, at age 75, get diagnosed with diabetes and like, damn, I tried to avoid this. And, they weren't on medications, but they were just so frustrated that they did everything right to their knowledge and they still have it. But, sometimes we don't have control over the amount of insulin your body gradually reduces as you age. Every person's different in that regard. So,
and like you said, some of it is hereditary.
absolutely, there is a hereditary component, and she had a strong hereditary component. All right. Well, we're going to wrap it up. But first, I want to thank both of you. You guys are awesome. Really appreciate it.
Thank you.
Yeah, so the most important message for both the long-term and the short-term complications is that you can prevent or delay their onset with good blood sugar control. In our final episode in the diabetes series, we're going to review the important things that each of you can do to control your blood sugar in the best possible way. And we're going to review the different screening tests that are very important that help identify the potential, that can help identify your risk of long-term complications, and finish up with the importance of taking charge of your diabetes. So until then, stay healthy and safe. Thank you.
Thank you very much.
Thank you.